Phase 1, Nurse's endorsement report given by emergency room nurse to primary nurse and student nurse. Adaan GIson is a 65-year-old male. He came to us in the emergency room this morning from a nursing home with complaints of abdominal pain and worsening confusion. He has a history of just being discharged from the hospital 10 days ago with congestive heart failure and urinary retention. He has a history of minor dementia, CHF, hypertension, and type 2 diabetes mellitus. Apparently, at the nursing home, he got much more confused and agitated than normal and also said his stomach has been hurting. When we received he had a Foley in place that was full of cloudy amber urine, so I changed the Foley. He has an order for a urinalysis and culture and sensitivity, but I haven't obtained that yet. His doctor orders are on the chart. His vital signs in the ER were pretty good: BP 118/72, pulse 84, and regular, respiratory rate 16, O2 sat was 96% on room air, his lungs were clear, abdomen soft, and non-tender. He is alert, but only oriented to people. He told me he was at the shopping complex when I asked him where he was. Lastly, his labs we drew in the ER came back. There they are: WBC 10,500, glucose 135, BUN 54, creatinine 1.8, and lactate 6.0. Any questions? What do the laboratory numbers mean? Can you tell me why he had to be admitted this time? What is wrong with him? He is so much more confused than usual.
He is admitted for urinary tract infection. They will investigate the cause of his illness.
Are they going to test that urine? The ER nurse said he is going for a CT scan. My sister's kidneys shut down when she had an X-ray with that dye.
Yes, the lab will test that urine. The CT scan with the water-soluble dye is helpful to diagnose his acute illness.
Aren't they going to start an antibiotic on his? Now that I know he is settled in, I'm going to leave for a couple of hours.
The doctor will start an antibiotic now. We will be monitoring his progress and continue to assess him for changes in his condition.
Continue intravenous fluids. Give antibiotics. Give dritacogen alpha. Administer blood products, if hemoglobin is below 70 grams/dl. Give midazolam and fentanyl. Control the blood glucose with sliding scale insulin. Use low molecular weight heparin. Use mechanical compression devices to prevent deep vein thrombosis. Use histamine 2 receptor blockers. I want off of this airplane.
Intravenous fluid bolus of 0.9% NS 500 ml in 1 hour. Change O2 to non-rebreather mask. Stat CMP, CBC, lactate level, ABGs, blood cultures.